Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 319 of the Ask Dr. Angela podcast. I'm going to jump right into today's topic. And again, y'all know I can talk about just about anything. And today's topic kind of grabbed me because I was, flipping through a magazine on my desk. And one of the, articles said the STD epidemic, why we need to care. And this, again, is from OBG Management. It's one of my favorite magazines. I like it because it's an easy read, not too involved. And, I can kind of just peruse, the topics and pick and choose what's important, what I need brushing up on, etc. So today's podcast, we're going to be talking about STIs, or sexually transmitted infections, and why they are such a big deal. So just a little bit of background. I think it's important to know that half of all reported STIs occur in women that are between the ages of 15 and 24. And not a huge surprise here, but Black folks, i.e. Black women, have rates that are 12 times higher than our white or Caucasian counterparts. STIs, or sexually transmitted infections, are not without consequences. One of the things that I am increasingly amazed at is, when I call patients and inform them that they have a sexually transmitted infection, I'm really a little taken aback at how cavalier and nonchalant people are about that. I'm like, Mrs. Such and Such, I was going over your labs and it turns out that you were positive for chlamydia, or you have gonorrhea, or you have syphilis, whatever. And people are like, okay. I just think about myself. And if someone told me that I had an STI, I would be freaking out. But that's just me. I'm a little bit, just who I am. But I'm increasingly surprised at just how, this kind of news being told that, you have an STI doesn't really kind of affect a lot of people. And that just speaks to how common STIs are. I guess it's just like one of those things. Oh, wow. Well, it really shouldn't be, oh, well, because there are certainly clinical consequences for women, babies, moms when you are infected with an STI. STIs, are really the most common among reproductive age women. And when you have an infection like a sexually transmitted infection, it can lead to things like PID, or pelvic inflammatory disease, infertility, and it certainly puts you at an increased risk of ectopic pregnancy. You also have an increased risk of acquiring other STIs. HIV comes to mind. Consequences of having an STI that goes untreated, specifically in pregnancy. Let's take chlamydia, for example. The baby can get pneumonia. We call that neonatal pneumonia, neonatal conjunctivitis, low birth weight, premature rupture of membranes, preterm labor, postpartum endometritis, or an infection after delivery of baby. Untreated gonorrhea can cause some similar things. Neonatal conjunctivitis again, low birth weight, miscarriage, again, premature rupture of membranes, preterm labor, and chorioamnionitis, which is an infection during actual labor. One of the significant things about preterm birth is that it is the leading cause of infant morbidity and mortality. And of course, I don't mean to keep saying of course, but most of these things typically do disproportionately affect the non-white race. So Black folk, African Americans, are at an increased risk, from preterm birth, and that's just kind of what it is. But it's really important to test for STIs and then to treat them, because as I've just stated, it can have some pretty significant consequences. So, it's really important to screen women for STIs. A really important stat to know is that 80% of infected women are completely asymptomatic. Most of the people that I call and inform that they have gonorrhea, chlamydia, or whatever have no symptoms at all. So that becomes really important, adequate screening. Typically, in accord with ACOG, annual screening for gonorrhea and chlamydia is recommended for women that are younger than 25. In my patients that are older than 25, at annual exams or visits, I always ask appropriate questions to see if they're at an increased risk. And certainly, you can always request testing for STI, specifically if you're in a new relationship, etc. In women that do test positive for sexually transmitted infections, treatment is really important to prevent some of the sequelae that I previously mentioned, specifically as relates to issues with infertility, pelvic inflammatory disease, etc., and then certainly the consequences and effects that it can have on pregnancy, which are pretty significant. Typically, it's important. I always, in patients that I diagnose with STIs, I typically will do expedited partner treatment. I'm not sure if that's allowed in your state. You'll certainly want to inquire. If it's not, your OBGYN typically will recommend that your partner or partners be notified as well as treated. So the take-home message from this podcast is sexually transmitted infections are a big deal. And where there is one, more than likely there can be others. You're at an increased risk for others. For those of you that are not being routinely screened, specifically if you're over 25 and you think that you're at an increased risk, please ask. And for those of you that are under 25 and are getting routine screening for gonorrhea and chlamydia, you can also ask for more extensive screening for things like syphilis, HIV, etc., if you feel like you are at an increased risk for those things. So STIs, they are a bigger deal than we make them out to be. So please make sure that you are safe. And that's a wrap. Thank you so much for tuning into today's podcast. I love all of the support, all the shout outs. For those of you who are new to the podcast, you can check me out, get more information on me and about me at www.askdrangela.com. That's ASKDRANGELA.com. There you can sign up for my blog post. You can sign up for my podcast, my YouTube channel. You can follow me on all of my social media channels. That's going to be Instagram, Facebook, and Twitter. And again, just thank you for the love and the support. I am going to leave you with another one of my favorites from Life's Little Instruction Book. This is lesson number 299, and it says, don't believe people when they ask you to be honest with them. Something to ponder on. Until next time, I cannot wait to reconnect with you on episode 320 of the Ask Dr. Angela podcast. Remember, choose happiness. Until next time.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.